Hi, my name is Diana Karamakoska, and in this video we're going to be looking at self-awareness in communication. What is it to be self-aware, and how do we become self-aware? Well, it is the means by which a person gains knowledge and understanding of all aspects of the self-concept. That is, the interests, skills, values, personality, the occupation, or the roles the individual has in society. It is the conscious use of this information to ensure equal, fair, and unbiased healthcare provision. And it requires self-reflection. So why is self-awareness necessary? It enhances self-understanding. It allows the acceptance of others, which is a very important aspect to maintaining the therapeutic relationship, and it enables us to handle difficult situations. It also increases the conscious use of the self. It enables self-monitoring so that we can reflect and also change or improve on aspects of ourselves. And it also enhances personal autonomy to become a more independent individual. When we look at the Johari window, this was developed to understand the 4 different selves that can come about. When we know ourself and our self is known to others, we consider this an open area to the self. When we are not known to the self, but it's known to others, this can be considered as a blind area or the blind self. Then, when we're known to ourselves, but not known to others, it's considered as a hidden self. And lastly, when you're not known to yourself and you're not known to your others, then it's the unknown area in which further exploration is required. So to look more in detail about these Johari windows, we're going to focus on the first domain, the open self. It's when our information is known to others that we already know about ourselves, anything ranging from our attitudes, desires, ideas, values, our personality traits, our temperament. And this is what we consider as our public self because we're not afraid of showing these characteristics. However, the hidden self or the private self is the one that cannot be known to others unless we disclose of it. The degree to which we share ourselves with others is the degree to which we can be known. Looking at the other domains, the blind self is considered the semi-public self because there are things that we don't know about ourselves that others can actually see more clearly. These are also the things that we imagine to be true of ourselves for a variety of reasons, but that others do not see at all. And lastly, our unknown inner self is an unconscious dimension. From time to time, something from our unconscious is revealed. Then we know what we have never known before. Looking at self-awareness in the therapeutic relationship, it is a psychological mindset of the health professional that influences the emotional availability for developing an effective therapeutic relationship. The health professional must set aside all personal prejudices, interests, and anxieties to benefit the client and look out for their best interest. The health professional must be able to observe their own behaviour as well as the client's with unflinching self-scrutiny and total honesty. Health professionals must treat each client with respect and as a person of value, even if they can't understand or approve of certain behaviours. You need to be able to acknowledge when you are becoming over-involved with your client and spending too much time focusing on personal issues that are not relevant to the case. And you also need to acknowledge times of avoidance where you do not want to broach a particular topic or item being discussed with your client because you may have anxieties around it or you are unfamiliar with it. You also need to avoid things like anger coming about and frustration with your client, especially when compliance isn't high. Detachment can often occur when there is a breakdown in the therapeutic relationship, and this can be sensed by both the patient and the health professional. And when this happens, we need to make sure that we are doing what we can to rebuild that relationship back up to ensure that our client does have confidence and trust within us. And finally, it's also important to acknowledge your own issues. So whether it may be from grief or personal factors, there will be times where you are discussing things with a client or a patient in which a topic or an issue has been brought up that draws on personal experience. If this occurs, you should try to address these issues immediately outside of your workplace, because you don't want to have stresses or personal issues affecting your relationships with your clients or patients, and even with your colleagues in the workplace or the organisation. Being self-aware of our own issues can help combat any potential future issues that might arise, particularly in this setting where we are discussing things with our clients or patients that may bear relevance to something that we have experienced in the past or are currently experiencing.